Well, a confirmed case of measles on the UW-Madison campus is prompting concern in our area, but health officials say most people are protected if they're vaccinated. The student lives in an off-campus apartment and may have contracted the highly contagious virus while traveling overseas. It's been a minute since we've seen UW Health's Dr. Jeff Potoff. Good to have you back with us.
Good to see you.
Yeah, good to see you as well. So how concerned are you about this? This is the second positive measles case in the state. Are you concerned about it, and how concerned should the rest of us be about it?
Yeah, I think there's always some risk there because we're a fairly under-vaccinated state, which means that even in Dane County, where there is more vaccination, there could be people who were out in public who came in contact with this individual who had measles, and that means 9 out of 10 of them have a good chance of coming down with the disease. I think the important thing to do right now is just really robust contact tracing, find those individuals who could have come in contact, see if they're vaccinated or not, and if they're not vaccinated, get them to quarantine so that they don't end up spreading the disease to more people.
Most of us get the measles, mumps, rubella vaccine when we're babies.
Yep.
So what do you do if you don't know if you've been vaccinated?
Yeah, there's a few things you can do. So if you were born in Wisconsin, Wisconsin has a great Wisconsin immunization registry. As a person, you can go online and look it up. It'll tell you when you got your MMR vaccine. If you were vaccinated in a different state, you might have to go look at that state. Let's say you can't find it anywhere. You can talk to your doctor's office and you can get serologies. You can actually get a blood test that says, yep, looks like you were vaccinated against measles. Those are different ways you can figure it out.
And if you've been vaccinated, you have nothing to worry about.
Yep, if you've been vaccinated, we really aren't too worried about you. The vaccine, if you've got those 2 doses, 97% effective against preventing you from getting measles. So you kind of get a pass. It's okay if you were in the same location as this individual.
Do older people need boosters, or once you're vaccinated, you're good?
Most people don't need a booster. There's a period of time when the vaccine first became available in the 1960s where you might need a booster. So if you're in that group, I don't know the exact date range, but 1960, 1965, maybe talk to your primary care doctor, but most of us are completely covered.
What are the symptoms of this? And if you're exposed, how soon do symptoms present themselves?
Great question. So symptoms will usually present anywhere from 7 days after exposure to 21 days after exposure. Most likely though, 13, 14 days after exposure. The first symptoms you're going to have are going to feel a lot like a cold. So you're going to get a runny nose, you're going to get a cough, you might get some watery, itchy red eyes, fever, you might feel a little bit punky and not have much appetite. That'll go on for anywhere from like 2 to 5 days, and then you'll get the rash. And the rash will typically start on your forehead or your face and work its way down. That's one of the things that's somewhat characteristics of measles, is that the rash will often start on the head.
And once the rash appears, if you haven't been vaccinated, can you get vaccinated at that point?
No, so that's the thing. Like, once you're exposed to measles, it's kind of too late. You're just going to take your chances. But with measles in the community, if you're not vaccinated, a really good time to think about, do I really want to take my chances with measles, or do I just want to go get vaccinated and not have to worry about this? Whether I get sick, I go to the hospital, or even having to quarantine for like 2 weeks, like who wants to do that?
Yeah. So what is your main message for people who might have concerns or questions about it?
Yeah, I think people who are listening who are downtown Madison, maybe they've gone to the Public Health Madison Dane County website. They're like, hey, I was at Qdoba, like what should I do? I think the one thing you could do is you could call Public Health Madison Dane County and get some advice there. If you were there and you're unvaccinated, you might want to consider quarantining. It's usually you quarantine from 7 days after exposure, so you start on day 7 and you go to day 21, it's 14 days. But these are all questions you can ask the Public Health Department about how to stay safe. If this was like too close for comfort and you're like, boy, I'm a little bit worried about measles, think about getting vaccinated. If you're vaccinated, this is not a big deal. It all goes away.
And the UW is targeting areas. I think they've already reached out to about 4,000 people who may have come in contact with this person. Yeah. So heads up, and be aware. Dr. Potoff, it's so great to see you.
Same.
Good to have you back.
Thank you. Appreciate it.
Don't stay away too long this time.
I'll try not to.
Okay.